Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello and welcome to another episode of the Wellness Optimizing Warrior MD. The last two episodes are focused on how to choose a doctor and how to choose a wellness doctor. Before I move on and bring into the discussion the medical team and all kinds of other things related to insurance and accessibility to medical care, especially in the United States, let's talk a little bit more about, do we need doctors who are wellness experts? And what would that look like? In the past two episodes, again, I mentioned wellness. It's very different than the state of disease. And ideally, we would like to invest in wellness, not in disease. So that's what the theme of the podcast will be today. How do we not focus on disease and actually shift the focus on wellness? And do we actually need doctors who are wellness experts? So let's start with the idea of the expert. Wouldn't it be great if all doctors that are available today would actually be considered experts at what they do? For you, the patient, the client, the customer, the consumer. First, what is the definition of an expert? So I looked up online, first page of Google, one of the top definitions that comes into view is very simple and a little long, so I'll read it out to you. An expert can be believed by virtue of credentials, training, education, profession, publication, or experience to have special knowledge of a subject beyond that of an average person, sufficient that others may officially, open parentheses, and legally, close parentheses, rely upon the individual's opinion on that topic. So according to this definition, all physicians should be experts because by virtue of our training and credentials, we have special knowledge of a specific medical subject, system, body part, body system. And we have definitely training in a specialty in medicine that goes beyond that of any average person. And clearly others may officially and legally rely on our opinion on this topic that we have trained on. So I actually looked into Wikipedia and I thought this is a little interesting. So I'm going to go ahead and read it out to you. An expert is somebody who has a broad and deep understanding and competence in terms of knowledge, skill, and experience through practice and education in a particular field or area of study. Informally, an expert is someone widely recognized as a reliable source of technique or skill and whose faculty for judging or deciding rightly, justly, or wisely is accorded authority and status by peers or the public in a specific, well-distinguished domain. So an expert more generally is a person with extensive knowledge or ability based on research, experience, or occupation in a particular area of study. So it's a pretty long, involved, convoluted, detailed definition of an expert. Also, let me just mention that the next paragraph in Wikipedia says, experts are called in for advice on their respective subject, but they do not always agree on the particulars of a field of study. Boom. So it's very interesting because it means we have multiple experts in the same field and they will not agree. And I guess that's okay. So no wonder the field of medicine is riddled with so many uncertainties and misconceptions and misinformation because we have so many experts that do not agree pretty much on anything. So I kind of simply put in my mind, in my own words, I believe an expert is someone with a vast amount of knowledge in a certain field, as well as a vast amount of experience of applying that knowledge to that field. So, how does this notion of being an expert, needing an expert, apply to medicine when everyone seems to be an expert in something today? Well, by definition, the practice of medicine is the practice of keeping someone healthy and the practice of restoring someone's health when they have either an alteration of the state of health or a loss of their state of health, which we call disease or pathology. So the whole topic of the podcast is wellness experts. Do we need wellness experts? So what I want to establish, and I want to make it clear because it sounds clear in my mind with my knowledge, and this is what I'm trying to verbalize in this podcast episode, the art of keeping someone healthy versus the art of restoring health when someone has a disease, which again, as I said before, a disease is an alteration or a complete loss of health. These two fields would be very completely different specialties, very different fields of knowledge. I would like to dig deeper into this topic and consider if this might be true. And if it's true, then why? So this question, formulated differently, is, would an expert at curing disease also be an expert at keeping someone healthy and free of disease? Well, clearly, in order to keep someone healthy, we have to understand and define the state of well-being, the state of complete and normal harmony and balance, which we call homeostasis, of all and every single system in the body, physical, mental, and emotional. The wealth of knowledge that goes into understanding this state of harmony, of balance and health is truly different than the amount of knowledge that goes into learning, knowing, and understanding disease. Why? Well, for many reasons. First of all, there's not just one disease. There are many. So let's talk about this whole expert thing. Can you really be an expert in all diseases? Not really. So you have to be an expert in one or maybe a couple of diseases, maybe a narrow field of a type of disease, like an expert in infectious disease medicine, an expert in hormone medicine, an expert in cardiovascular medicine, an expert in female genital problem medicine, children's medicine, mental health medicine, joint disease medicine, etc. So as a doctor, we'll be doing the same thing over and over again, a few times or many times a day, every day, many years in a row. That would indeed make that doctor very skilled and knowledgeable at doing that same thing. And this is very true where procedures are concerned. The more procedures a doctor will do, the better skilled he or she might be at doing that type of procedure. That is the power of experience. And the skills are developed continuously because as a surgeon, you're confronted with many situations that are different, and your skill range will expand and your ability to deal with unexpected situations will also expand. Now, it's a little bit more complicated when we consider the practice of medicine, because the science of medicine involves the power of listening, interpreting data, the power of deductive reasoning, formulating a treatment plan, and being aware of many or possibly all treatment options that apply to that case or that patient. A surgeon or a doctor that performs a procedure needs to have certain characteristics. Surgery is a very complex process involving detailed knowledge of anatomy, skill in handling certain instruments, like the Da Vinci robot, for example, or a laparoscopic array of instruments. It involves the requirement to handle the human tissues delicately with respect, involves mental fortitude, stamina and endurance, and experience in dealing with all possible circumstances, including the unexpected, as well as handling possible complications, and involves a great respect for the human anatomy and tissues. And last but not least, that surgeon has to be motivated by a desire to put everything back together in a better shape, form, and for better function. Now, the non-surgeon, non-procedure medical doctors rely on very different set of skills compared to a surgeon. Like I mentioned, they need to be able to gather and interpret the data provided to them. They need to have a very broad knowledge of how to interpret this available data. And they need to use their superpower of problem solving to formulate a treatment plan. They will also need to communicate this treatment plan in a manner that can be used by the patient effectively to achieve the optimal outcome of a cure. Coming back to the word expert, now that I mentioned all these qualities that would be ideal to have in a surgeon doctor or non-surgeon doctor, the word expert is really flaunted about very freely. And many people use it without clearly understanding what an expert is or what is needed to actually become an expert. Now, I personally think it might be very hard to consider one an expert at the practice of medicine when, for example, that doctor is a family practice doctor or an internal medicine doctor or a naturopathic doctor, a chiropractor, an acupuncturist, even an OBGYN. Why? Because sometimes that field of medicine is way too broad to be an actual expert in it. Compared to the average person, any doctor is an expert because they clearly know more than any average person regarding the practice of medicine in that field that they're practicing. However, within the medical world, our field of practice might be too broad to actually be an expert. However, the way the doctor uses his or her knowledge, and especially the way he or she uses the superpower of interpreting data and formulating a treatment plan, could be quite unique. And if that doctor will consistently achieve optimal healthy outcomes in a reliable and predictable manner, suddenly that would make him or her an expert at what they do. Let's dig into this a little deeper. There are very many different specialties in medicine in today's day and age. Practicing medicine today is very, very different than the medicine doctors used to practice 100 or 200 years ago. Does that necessarily mean that all doctors are experts just because their field of knowledge and experience is much more narrow than it used to be? And that's not necessarily true because the practice of medicine now, it's extremely divided. So narrowing the field of knowledge doesn't necessarily make everyone who's got a narrow field of knowledge an expert. It does compared to the general population, but not within the medical world. The truth is that the knowledge, technology, and the therapeutic advances that have been made in medicine in the past 100 years have been so outstanding and everything happens so fast. It's absolutely impossible for one human being, your regular doctor, to possibly comprehend everything there is to know about our human body and how to cure all the possible illnesses that could afflict it. So the way medicine was practiced 100 years ago, where the doctor would know everything about everything and would have very limited amounts of treating those conditions, has come a long, long way, and medicine looks very different today. Well, is that a good thing? Of course. It is a good thing, and it should be a good thing. It should be an excellent thing. However, the practice of medicine is so divided that when you have a serious problem that involves many systems, it makes it super hard for some patients to know what doctor to go to and how to choose a doctor. It also makes it very different for the doctors that see those kind of patients because their narrowed field of practice and the way they've been doing things over and over the same way might not apply to that patient. And that patient is left standing at the end of the game of musical chairs, or at least that's how they feel. In today's medicine, we do have an overabundance of specialists. And honestly, I believe many medical graduates fall in love or develop a passion for a certain field of medicine, and they just want to practice medicine in that field and address their passion. What I think it's a problem is that I don't believe many people have a passion for being the family practice doctor that everyone still needs. I personally believe that the family practice doctor should be highly regarded, highly trained, and should have a vast knowledge of a very large array of possible conditions and illnesses, with an extremely broad understanding of the concept of health and wellness and what we need to maintain that, and a broad understanding of all the therapeutic options or blood work and tests and imaging that needs to be ordered to do the workup and to follow through and identify an illness, and perhaps refer that patient out to a specialist for further care. But I am afraid that my requirements or my requisites for such family practice wellness specialists might be a little too lofty and ideal to be achieved in this real world. The main impediment is that the practice of family medicine or wellness, which is really what the practice of family medicine should be about, is not rewarded monetarily enough for many people, many doctors, to feel that they could comfortably make a living by practicing this type of medicine. It's also very stressful. So when a provider is not being trained, does not have the knowledge of how the systems of the body work together, how the systems of our bodies balance each other out, how one influences the rest, it will be likely impossible, if not very difficult, for that doctor to consider approaching our body's health and wellness or curing the disease from a comprehensive, holistic point of view. And I'm sorry to say, and I'm afraid, that narrowing the field of medicine and dividing doctors in so many specialties, with some of these specialties having a very narrow scope of focus and caring only for a small part or system of the human body, might unfortunately be to our detriment, to your detriment, the patient. The art of looking at the big picture, the art of interpreting all of the data, all the signs and symptoms of all the systems and organs of the body, the art of looking at the mental health and the social economic factors that are implicated in your state of health or disease is absolutely lost. That means it will be impossible to weed out disease as we know it nowadays. Now, I also believe that our division in healthcare is very similar to a fragmented, poorly functioning, non-communicating, dysfunctional team, all because of lack of charismatic, talented, idealistic, and altruistic leadership. We just don't have that in our medical world. On top of all the lack of leadership in healthcare, doctors are told how many patients to see, what tests they are allowed to be ordered by the insurance plan, what vaccines to give and when, and overall how to practice medicine by many organizations and people that have no medical training. Now, more than ever, it's apparent that the root cause of many illnesses, like autoimmune problems, severe mental health illness, anxiety, depression, hormone disruptions, and hormone deficiencies, they all start somewhat very simplistically with stress. Stress is causing significant damage to our bodies physically, with the initial insult or injury or assault being on the digestive intestinal lining, with major widespread consequences for the rest of the body, just like ripples in a pond. It's very possible that the root cause of the majority of disease we are facing now is actually, simply put, widespread inflammation of the body with a dysfunctional immune system taking over and not knowing how to stop this wildfire of inflammation that's spreading, that's interrupting the normal functioning of absolutely everything, including hormone receptors, and ultimately disrupting our mitochondria, the powerhouse of every cell in our body, which will lead to deficiencies, inefficiencies, and loss of function. It's not really easy to find out this information. And rarely you will go to a doctor that's a conventional medicine doctor trained that will provide this information for you. You won't hear it from a specialist because they're so narrowly focused on how to eliminate pathology in their little part of the body system that they don't look at the big picture. Again, many doctors are specialized in a system and a specific body part. And many times the treatment simply will involve, let's just take that diseased organ out. So now you get referred to a surgeon. And I'll take a little detour here. And I just want to say that it is sad that in the absence of cancer, for many pathologies and diseases that develop in the human body, the ultimate cure recommended will be, let's take it out. Surgery, cut it all out. Most of the times that is necessary because the organ has become diseased past the point of healing itself, or diseased past the point that the doctors will actually have the ability to heal, whether it's conventional medicine or natural holistic therapies. And let me give you a couple of situations where that might be the case. For example, a diseased gallbladder suffering from gallstones and inflammation of the wall would most likely be recommended to be surgically excised. A diseased and compromised uterus with many fibroids or with severe adenomyosis will most likely be recommended to be surgically removed. A diseased part of the colon, the large intestine, that suffers from severe inflammation or a perforated diverticulitis will probably need to be removed surgically. And finally, a diseased and inflamed appendix will need to be removed surgically. Otherwise, the person could die. The interesting question, and what I like to talk about in this episode, and I'm coming back to my wellness expert topic, is could we do something years ahead to actually prevent developing this type of pathology that would eventually require your organ to become diseased and need to be removed? For that, it would require a totally brand new type of thinking that would require shifting you, the patient, and shifting us, the doctors, from the mentality of waiting for an illness and then trying to fix it with medicine or with surgery, to instead focus on looking at the big picture, how we eat, how we exercise, how we work, how we interact with our environment, how happy or unhappy we are. Focus on promoting wellness and avoiding disease rather than waiting for disease to come and then doing something about it. Well, when I put it this way, I bet you're thinking, well, that's the way it should be, right? But it isn't, and it has not been this way for a very long time. Us doctors were simply trained to cure disease in medical school and residency, and in conferences that we follow and go to after residency is over and continue our training. There is minimal to no training in the science of wellness. There is no specialty called wellness medicine, but there should be. And wellness medicine should look at many things and many aspects, including everything I mentioned before, and consider the fact that wellness checks would have a totally different meaning under these circumstances. Wellness checks is not something that you do once a year because things are changing so much and so fast in our world and in our bodies that just seeing a wellness doctor once a year, it's not something that will help you from preventing disease. Wellness medicine should be something you practice daily as a patient. But wellness medicine, as it happens as a consultation, should be practiced minimally 2 to 3 times a year. And it should be with a wellness physician that is ideally skilled and trained to focus on wellness medicine. That might look like including nutrient optimization, optimal hormone balance, optimal lifestyle, a physician who would offer support and counseling on all of these issues, and even perform a fitness evaluation, discuss musculoskeletal strength, and much more. Everything physically should be looked at, discussed, and evaluated, starting with mental health, and it likely should happen in a quarterly visit format, minimum every 6 months, to evaluate and maintain a wellness state of being. Probably 3 to 4 times a year for someone that's over 50 and twice a year for someone who's under 50. Whatever you're hearing today might be completely new to you, and it might be a different point of view that you've never heard before. In its own way, it might be entirely revolutionary because it's rebelling against the current norm of waiting for disease and doing nothing until you reach a disease state that's manifesting with symptoms. If you believe that going to the doctor once a year as a woman for a pap smear and a breast exam, to get an order for a mammogram and get an order for a blood test, usually whatever's covered by your insurance, which is extremely basic and most of the time tells you and your doctor minimal information or nothing about inflammation, gut health, hormone, nutrient health, etc. If you believe all of this is enough to maintain wellness, well, then I have news for you. This is far from enough to assess your wellness and prevent disease. If you have the belief that going to the doctor once a year for your pap, mammogram, blood test, prostate check, EKG, stool test, bone density test was enough to keep you away from major illness or cancer, I hope you realize you are mistaken. This type of checkup or a wellness check is not really a wellness check in the wellness sense. And this is not practicing wellness medicine. Wellness medicine should be a specialty in as of itself. And as a listener, you should know that this is something the public has not been educated on, has not been informed that it could exist or it exists, but it does exist. It's just branded differently. Hormone optimization, anti-aging, functional medicine, it has different names, but all the doctors who practice hormone optimization, anti-aging, functional medicine are actually practicing wellness medicine because they focus on restoring wellness and promoting wellness once it's restored. Again, if you did listen to this episode and you believed that you should wait till you get sick in order to see a doctor, maybe this will change your mind and maybe this will change your approach. And it might even change your beliefs around this issue. Unfortunately, us human beings value something when we don't have it anymore, when we lose it. No one values wellness and health more than when they are actually sick. Well, I dare say, as I'm wrapping it up and approaching the end, I dare say I would like to make a pretty bold statement with this podcast episode that we have a huge need to develop a wellness medicine field. There's a huge need for many doctors to specialize in this field of wellness medicine. This might not necessarily look like just a regular conventional medical school, just up and adding a wellness curriculum. This might start with an organization that's perhaps dedicated to functional medicine, to anti-aging, to hormone optimization, who develops a program and the curriculum, organizes courses, and trains established and experienced physicians that are very familiar with the state of disease and know now how to avoid it, what to avoid, and more importantly, can also cure disease if necessary. But the focus for such a doctor will mainly be on prevention and focusing on the root cause of all illness. The focus for such a doctor will be to apply wellness principles of counseling and guidance on how to avoid developing out-of-control inflammation, how to avoid damage to your digestive health system, how to support optimal nutrition, how to handle mental, emotional, financial stress. Ultimately, stress, which is undeniably putting a huge load on our body's brain and nervous system, reminding us not to forget that the mind controls all our other systems and everything cascades down in the form of symptoms and illness when suffering overwhelming stress. I really hope today's episode, if you had the patience to listen till the end, planted a seed in your mind about how things should be or might be. I hope it has perhaps opened your mind to the concept of wellness and how complicated it could be rather than just focusing on disease, which is the current state of practice in today's world of medicine, but instead making a shift for the practice of wellness. Any major world-changing movement in history started with one person, one idea, and then it eventually became a group. And before you know it, it became a movement, and then it became history. The idea of wellness medicine is not new. It has been around since Hippocrates, who said, "First, do no harm." I'd like to ask you a few questions before I end this episode. Is what we're doing today doing no harm? Are we doing no harm with all the drugs that have been invented and manufactured to address inflammation? Are we really doing no harm by recommending chronic use of Advil or ibuprofen over the counter to alleviate aches and pains or arthritis instead of addressing inflammation and the problem that leads to arthritis? Are we doing no harm by prescribing blood pressure medications, some of them with some very serious side effects and consequences, rather than understanding and addressing and preventing the cause of high blood pressure? Are we really doing no harm by prescribing birth control pills as medicine when a woman does not need birth control? Are we doing no harm by telling women that the sex hormones like estrogen, testosterone, and progesterone, which have nourished their bodies for decades, are we doing no harm by telling women that hormones are bad for them after menopause, or they will increase the risk of cancer? Are doctors really doing no harm by forwarding to their patients all this bad information that was provided 20 years ago in a study that has been since refuted by many other studies, by many experts, and by many specialists? Now that we live to 80 and beyond, are doctors really doing no harm by telling patients, men and women, that hormone replacement is bad for them? Are we doing no harm by condemning women and men to live decades past the prime of their life when their hormones dwindle and disappear, to live in pain, with anxiety, with depression, with lack of motivation, with a diminishing muscle mass that causes weakness, frailty, disease, aging, and ultimately death? Are doctors really doing no harm by spreading the information that hormone replacement therapy is bad and has risks for your health, when in reality, hormone replacement therapy is the best anti-aging tool we have, the best wellness tool we have as we lose our hormones and as our body changes due to this massive and poorly understood huge loss that literally causes a significant decline in our health and affects all men and all women past 50. Next time you are told something, anything, what I encourage you to do is to feel free to challenge your doctor with facts. Ask for facts. Ask for where did you get this information, and ask more questions. I'm absolutely astounded at how many patients choose a type of surgical intervention that has newly been introduced into the market, or a brand new medication that's just simply advertised on TV, that has been poorly studied for long-term life-lasting side effects or consequences, simply because it hasn't been available long enough. And they do that accepting the surgery, accepting the medication without asking any questions. I believe in progress, but I also believe in using first only firmly established and well-tested therapies and technologies that have been around for a long time, that are proven to be safe. I'm a conservative person. The newest, shiniest thing that you hear about on TV or that doctor you talk to might offer you because it's the newest thing might not be the best and safest thing for you. Just like I mentioned in my trailer episode, I would like to challenge the way medicine is done today. The way medicine is established and practiced nowadays is completely focused on disease. Hopefully with this episode, I have planted some new ideas and small seeds in your brain as to other avenues and possibilities that are out there. Until we meet again, I will end here and probably more on this topic in the future. Thank you for listening. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that. or wow, I'd like to know more. So keep listening and I'll keep talking.